Hi there, I'm SD Rose, a genetic counselor with JScreen. Today, we're talking about something that comes up a lot in my conversations with patients. What does a negative BRCA test result actually mean? Don't worry if you're not entirely sure. I'm here to explain it in simple terms. So you've gotten your BRCA test results back, and they're negative. That's great news, right? Well, yes and no. Let me explain what this really means for you and your health. Assuming your test used a technology called gene sequencing, a negative result means that no harmful mutations were found in your BRCA1 or BRCA2 genes. This is definitely good news. It means you don't have specific genetic changes in these genes that would significantly increase the risk of developing breast, ovarian, or other cancers. But here's the important part. A negative result doesn't mean that you'll never develop cancer. There are other genes related to cancer risk as well. And most cancers, including breast and ovarian cancers, occur in people without a cancer gene mutation. In fact, only about 5 to 10% of breast cancers are linked to BRCA and other cancer gene mutations. Think of it this way. BRCA mutations are like having a much higher risk for cancer. A negative test means that you're not at specifically higher risk, but you still have a chance to develop cancer over the course of your life, just like anyone else. Based on family history of cancer as well as other factors, that risk may even be significantly higher than average. So what does this mean for your health going forward? At minimum, you should follow the same screening guidelines as anyone else your age. For women, screening typically includes regular mammograms starting at age 40, but may also be earlier if your doctor recommends it based on other risk factors. Additional and more frequent screenings can also be important based on personal or family history of cancer. Sometimes families have a strong history of cancer, but testing for BRCA and other cancer genes comes back negative. This could mean a few things. 1, there might be other genetic factors that haven't yet been identified. Or 2, the cancer in your family might not be hereditary at all. The key takeaway? Make sure you've had comprehensive cancer genetic testing. A negative result is reassuring, but it's not a free pass to skip regular health screenings. Continue with routine screenings, keep up a healthy lifestyle, and stay aware of any changes in your body. Remember, genetic testing gives you valuable information, but it's just one piece of your overall health picture. The goal is to empower you with knowledge so that you can make informed decisions about your healthcare. If you have any questions about your test results or want to learn more about genetic testing, visit jscreen.org.